Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram, Delhi branch. This devotional song in the melodious voice of Mithu was a simple-minded prayer of a simple-minded devotee. And it was essentially a prayer and brought out so many features which characterize prayer. Firstly, the sugandha, the fragrance. It has a way of sort of diffusing, purifying, sanctifying, sweetening, and improving the atmosphere through that fragrance. Then, Nishabda Charo Or Chai. Prayer doesn't have to have any words. As Gandhiji said, in prayer, it's better to have the heart without the words than to have words without the heart. So essentially, the heart, the emotional part of the being, the feelings which matter in the prayer, not the words that are used. It's more of an attitude than a composition, a literary composition in which the words really matter. Then the third, that my devotion is behisab, without any calculations. It's not a transactional sort of an activity. You can't think in terms of a transaction when you are dealing with the transcendent. And then, kare sabki bhalai. A devotee often thinks that what use all this devotion if I do nothing for the object of my devotion? Now, the object of the devotion, the divine doesn't expect anything, doesn't need anything. And therefore, what really matters is what we do for the creation of the Creator, what we do for our fellow beings who are also the divine itself in another form. So I do something for them. And in fact, that has been sometimes considered even better than prayer. It's the hands that help are much better than the lips that pray. And then finally, that I do not expect anything. I don't expect any name and fame from my devotion to you. All what I expect is that I should continue to receive your love. Very short, but full of so many valuable reminders of what devotion is about. With that, we now turn towards the today's class, which is a practical class on the yogic practices that may be done during back pain and neck pain, even when it is acute. It may sound strange that any exercises can be done at all during that phase, but in fact, not only they can be done, but they should be done. They help in the recovery from the pain, and reduce the duration of the bed rest that is necessary. And therefore, that itself improves the recovery, because the longer one is in bed with back pain, the more the muscles would atrophy, and that itself can perpetuate the back pain. So with that little background, let's look at the video, the pre-recorded video on this subject. And then if you have any questions at the end of this video, we can take them up. Today's session is about the physical practices of yoga that would benefit a person having acute pain in the back or the neck. It might seem a little paradoxical that if the person has acute pain, how can that person take any exercises at all? The rationale is, firstly, that one of the contributors to the pain in these areas is muscle spasm, that is sustained contraction of the muscles
of the neck or the back. And one of the major aims of these practices is to relax the muscles. The exercises in themselves relax the muscles, but even more than that, it is the soothing voice of the teacher, the genuine and sincere love and empathy of the teacher for the student, and the relaxation and visualization, relaxation both physical and mental, and the type of visualization that we introduce, the chanting that we introduce in these practices, all these things contribute to the relaxation of the muscles. The second important way in which these exercises help is that they prevent the muscles from staying completely inactive for long periods. For example, if in acute back pain there is a strict bed rest required, that means that the muscles are not working at all, they are not being used. And if a muscle is not used for a long period of time, it atrophies, it becomes weaker, and that itself can contribute to the back pain, making it chronic. And another important thing that you'll notice in these practices is that although the muscles contract, there is no real movement. And therefore, the contraction of the muscles is perfectly safe. Now you'll say, how can we contract the muscles and have no movement? Imagine pushing a wall. Your muscles contract, you're making an effort, and yet the wall does not move. Neither the wall moves nor you move, and yet you are contracting the muscles. This is the type of contraction we call isometric, that is, there's no change in the length of the muscle, and yet the muscle is contracting. So these are some of the things that we'll use and will get illustrated as we go along. So suppose a person has acute back pain, and the person does not feel like doing anything. The person finds that even the slightest movement is painful, and this is an indication that the body is asking for bed rest, and that is the initial treatment in acute back pain. And it is strict bed rest, making all movements prohibited, except maybe going very carefully to the toilet. The person should lie down on the back or turn to the side. But while turning to the side or coming back from the side to the lying down on the back position, one should avoid twisting the back. And the person should lie down on a bed that is neither too soft nor too hard, just a firm bed. All the same, in spite of this strict bed rest, the person can start some exercises, if not on the first day, on the second day of the acute back pain. And let's start with the one which is the simplest, which can generally always be done, if not on the first, at least on the second day of the acute back pain. And this is pressing the back against the bed. So let's begin. Suppose this person, the student Arpita, she doesn't have back pain. Let's assume she has. Now she has to press the back against the bed. But before that, one of the things that helps in acute back pain is bending the legs at the knees. Bend your legs. Now what this does is to flatten the lumbar hollow. The person can do this, in fact, at any time during the day she feels like doing it, because this makes the lumbar hollow, that is this hollow space at the back, flat, so that now the entire back is in contact with the mat and supported. So the person feels much better in this position. Then what she can do is to press the back against the mat, and that will require an effort. The muscle is contracting, and yet since her entire back is in contact with the mat, it will have no movement. Sometimes it helps to have a rolled towel under the back in that hollow, but since the hollow has become flat, really speaking, it's not generally necessary to have this towel. Now, to make the person understand what you really mean by pressing the back against the mat, what one can do is to slide your hand under the back in the most painful area and tell the person to press your hand. Press my hand. Now, we'll now introduce a little method into this pressing the hand. Inhale. Breathe out as you press my hand. 1, 2, 3, 4, 5. Inhale. As you breathe out, press my hand. 1, 2, 3, 4, 5. Breathe in as you release. Breathe out as you press my hand. 1, 2, 3, 4, 5. Breathe in as you release. Breathe out as you press my hand. 1, 2, 3, 4, 5. Okay? So, we synchronized it with breathing. If you find initially the student is finding it difficult to synchronize with breathing, you can just start with pressing the back without any synchronization. Something like this. Press my hand. 1, 2, 3, 4, 5. Release. Press my hand. 1, 2, 3, 4, 5. Release. Press my hand. 1, 2, 3, 4, 5. Release. Press my hand. 1, 2, 3, 4, 5. So this is the simplest way to start, and then you can introduce synchronization with breathing. Inhale. As you breathe out, press my hand. 1, 2, 3, 4, 5. Inhale. As you breathe out, press my hand. 1, 2, 3, 4, 5. Release and inhale. As you breathe out, press my hand. 1, 2, 3, 4, 5. Now, this count of from 1 to 5 while she is breathing out is to ensure that she holds it there and keeps the back pressed against the mat at least up to the count of 5. As you saw, we can start without any synchronization with breathing and then go to synchronization, or if the student is a little trained in these practices, you can straight away start with synchronizing with breathing. So it all depends, on what type of a student you have. But assuming that the student is an absolute beginner, has never done any physical practices, it will be easiest to start with just pressing the hand first, learning to press the hand, that you can repeat 5 times, then synchronizing with pressing with breathing, pressing the hand every time while breathing out. That comes very naturally because as you breathe out, the abdomen goes in. When the abdomen goes in, the back also tends to go down, and that is the time you can press easily. So it's nothing sort of really that you have to remember. It comes very naturally. While breathing out, as the abdomen and the back are going down, you press your back against the mat. So you synchronize with breathing 5 times. So 5 times without any synchronization, then 5 times with synchronization with breathing, and then another 5 times synchronizing not only with breathing but also with chanting. Now what you chant is optional, but it's nice to have a sweet soothing sound that produces resonance in the body. And when we are in trouble, whom do we think of first? We think of our mother. And therefore one can chant Ma. That is a sound that is soothing, signifies someone who loves us, and it also produces a sweet resonance in the body. So now we'll do that. Now we'll synchronize with chanting. And if the student has picked up the hand, sort of pressing the back, then you don't necessarily have to place your hand under the patient's back. You can just instruct. So now we'll synchronize with chanting Ma. Okay. Inhale. As you breathe out, press the back against the mat and chant Ma. Inhale. Breathe out, press and chant Ma. Inhale. Breathe out. Press and chant Ma. Inhale. Breathe out. Press and chant Ma. Inhale. Breathe out. Press and chant Ma. Okay? This may be the only practice that can be done during the first 2 days of acute back pain. But then by the third day, you can move to more practices, other practices. And the next one, which is a little more difficult than this, is somewhat similar to Pavan Muktasana, but without lifting the head, and with one leg at a time to start with, and then with both legs together. Okay, so for that, straighten your legs, pick up one of the thighs and encircle the leg, take it close to the tummy, press, and now release. The other side. Release. The other side. Press. 1, 2, 3, 4, 5. Release. The other side. Press. 1, 2, 3, 4, 5. Release. The other side. Press. 1, 2, 3, 4, 5. Release. The other side. Press. 1, 2, 3, 4, 5. Okay? Now we'll synchronize this movement with breathing. Inhale. Breathe out as you press. 1, 2, 3, 4, 5. Inhale as you release. Breathe out as you bend the other leg and press. 1, 2, 3, 4, 5. Inhale as you release. Breathe out as you press the other leg. 1, 2, 3, 4, 5. Inhale as you release. Breathe out as you bend the other leg. Press and hold. 1, 2, 3, 4, 5. Inhale as you release the other leg. Inhale and then exhale as you press. 1, 2, 3, 4, 5. Inhale as you release the other leg. Press. 1, 2, 3, 4, 5. Inhale as you release. Okay. Now we'll synchronize this also with chanting. And we chant while breathing out. And now we'll do that. Inhale. Breathe out as you press and chant. Ma. Feel the soothing resonance of the chant. Inhale as you release. The other side. Breathe out. Press and chant. Ma. Inhale as you release. The other side. Ma. Inhale as you release. The other side. Breathe out, press and chant. Inhale as you release. The other side. The other side. Inhale as you release. Okay. So one can start with 5 repetitions without any synchronization. Another 5 times synchronizing with breathing. and another 5 times synchronizing with breathing and chanting. But all these repetitions are not sacrosanct. One can go by the pace of the student, the receptivity of the student, the time available, and finally when the student has mastered, instead of doing all these 3 steps, the student can straight away go to synchronizing with breathing and chanting and do it 10 times. And this type of practices can be repeated a few times a day, 3 to 4 times a day, by a person having acute back pain. Now we go to the next practice, which is a little more difficult, which one may be able to start on the 3rd or the 4th day of the acute back pain. And that is somewhat similar to the first half of Naukasana, or the boat pose, the lumbar stretch. Now first we'll do only the movement. Lift up your head, shoulders and the chest, keeping the hands forwards. Try to lift yourself a little more and keep the hands a little horizontal, parallel to the mat. Okay. Go back. Now again, lift your head, shoulders and the chest and the hands. 1, 2, 3, 4, 5. Come down slowly. Once again, lift yourself up. 1, 2, 3, 4, 5. Come back slowly. Now we'll synchronize with breathing. And we follow the general principle. When the body is stretching or opening up, we inhale. When it is folding up or squeezing, we exhale. So, inhalation while going down, exhalation while coming up. Okay. Inhale. Breathe out as you lift your head and shoulders and the chest. 1, 2, 3, 4, 5. Inhale as you come down slowly. Exhale as you lift yourself up. 1, 2, 3, 4, 5. Inhale as you come down slowly. Exhale as you lift yourself up. 1, 2, 3, 4, 5. Inhale as you come down slowly. Okay. Now we'll synchronize this movement also with the chant while breathing out, as always. We always chant while breathing out. Inhale. Lift yourself up as you breathe out and chant. Inhale as you come down slowly. Lift yourself up as you breathe out and chant. 1. Inhale as you come down slowly. Breathe out and chant. Feel the soothing resonance during the chant. Breathe out as you lift yourself up and chant. Inhale as you come down. Breathe out as you lift yourself up and chant. Inhale as you come down slowly. Breathe out as you lift yourself up and chant. Inhale as you come down slowly and relax. So these are the practices that can continue during the first week or 2 of the back pain, and if the acute back pain lasts more than 2 weeks, then it's better to get a thorough medical checkup done, because then the back pain may be due to reasons which are rather serious or require a little different type of approach. But most back pains would resolve quite well within the first week with bed rest and doing these exercises, starting with the simplest, that is pressing the back against the bed, and gradually after every 1 or 2 days adding yet one more practice. So we start with pressing the back against the bed Then we introduce Pavan Muktasan with one leg at a time, and then we go on to this Ardhanokasana or half a boat pose, and synchronize all these movements with the breathing and chanting. Now to this we can add also an element of visualization. Every time the person is chanting Ma, the person not only feels the soothing resonance throughout the body, but also visualizes her mother or the divine caressing the back with his or her arms. So feel that caress, that soothing touch, the therapeutic touch of the divine or your mother. So all this adds up and makes these exercises not only useful because of the physical effort involved, but also through the mind-body connection. The person feels relaxed, and that relaxes the muscles, and the person also develops that trust that yes, with this effort and the support of a loving one, the divine, that support is further helping me heal. So that's how this whole thing works together. And this is not just to make the person feel that it will happen because I'm doing this, but actually it does happen. There is certain healing mechanism in the body, and that self-healing mechanism requires the best conditions, and those best conditions are provided when the person has this connection with the highest force, a force that is expressed through love, and the person truly sort of is in a state of having full trust in the self-healing mechanisms which are being activated by all these processes. So the self-healing mechanisms work best when you provide the best conditions, and the best conditions include this connection with a higher force. So that is how it helps in acute back pain. Now, after these practices, every day the person can also actually lie down in Shavasana for some time. And in acute back pain, the Shavasana should be with the legs bent. That is much more comfortable than with the legs straight. So bend your legs. Hands a little away from the body. Palms facing upwards. Eyes closed. Slow and deep breathing. As you breathe in, the abdomen moves out. As you breathe out, the abdomen moves in. Now we'll synchronize this breathing with chanting. So once again, chanting Ma during breathing out. As you inhale, the abdomen moves out. As you breathe out, the abdomen moves in. Ma. Inhale. Breathe out and chant. Ma. Inhale. Ma. Inhale. Breathe out and chant. Ma. Feel the soothing resonance of the chant and visualize your mother or the divine caressing your back. Inhale. Breathe out, chant and visualize. You may continue on your own.
Wow.
Okay. Now we turn to acute pain in the neck. The general principles are the same as in case of the back. In case of acute neck pain, once again we can start the exercises on the first or at the most on the second day. And the first exercise would be pressing the head and the shoulders against the mat. So once again no movement is possible. Unlike in case of the back, however, it will be nice to support the neck with a folded towel. So you place the towel in this hollow and then pull the towel forwards towards your shoulders. Just leave like this. So fold it and pull it like this and then lie down. You can even pull it while you are lying down. You don't have to lift yourself up, because person with acute back pain will not be able to lift up. So just place the pillow under the neck and then pull it forwards. If you pull it forwards, then it will fit more snugly in this hollow and your neck will have a proper support. Now once you have brought so that it is fitting snugly in the hollow of the neck, you can just leave the towel and relax. Okay. Now once again we'll follow the same principle. Press the head and your shoulders against the mat. 1, 2, 3, 4, 5, release. Press the head and the shoulders against the mat. 1, 2, 3, 4, 5, release. Now we'll synchronize with breathing. And here it is opposite as compared to the back pain. And that again comes very naturally and logically. Because as you breathe in, the abdomen moves out, the back lifts itself up, and that is the time when the neck has a tendency to go back. So that would be the best time to press the head against the mat. So here we press the head against the mat while breathing in. Okay. Inhale as you press the head and the shoulders against the mat. 1, 2, 3, 4, 5. Release and you exhale. Inhale as you press the head and the shoulders against the mat. 1, 2, 3, 4, 5. Breathe out as you release. Inhale as you press the head and the shoulders against the mat. 1, 2, 3, 4, 5. Breathe out as you release. So this can be done 5 times. Then we synchronize with the chant. And once again we chant while breathing out. Inhale and hold. 1, 2, 3, 4, 5. Breathe out and release and chant. Ma. Feel the soothing resonance of the chant. Inhale and press. 1, 2, 3, 4, 5. Breathe out, release and chant. Inhale and press the head against the mat. 1, 2, 3, 4, 5. Breathe out and release and chant. Inhale. 1, 2, 3, 4, 5. Exhale. Inhale. 1, 2, 3, 4, 5. Release. Inhale. Release. So it goes like that. We're going a little faster than we would in a real class, because otherwise this class here will become boring. In a physical class, we take a little longer go a little slower, and the number of repetitions depends upon the class you have, the time available, etc. But in practice, if the person actually has acute neck pain, then again these practices should be done uh, at around 10 times, 3 to 4 times a day. And for these simple practices like this, doesn't have to be a 4-hour gap between the meal and the practice. It can be done even half an hour after a meal. Now, this is the simplest, and by the second or third day of the neck pain, we can add more practices, and one of them is hands in and out breathing. So we do this hands in and out breathing, which normally is a warm up in the standing position. We perform a similar movement in the lying down position. Now, inhale as you take the arms sideways. Exhale as you bring them back. Inhale. Exhale. Inhale. Exhale. Inhale. Okay? Now we'll synchronize it with chanting. Inhale. Exhale as you bring the hands forwards and chant. Inhale. Exhale. Inhale. Ma. 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 Okay, relax in Shavasana. Now the next practice that we can add after 2 or 3 days of the acute neck pain is rolling the neck sideways. Now first we'll start with just the movement without any synchronization. Turn the head towards the right. Bring it back slowly. Now turn to the left. Bring it back slowly. Turn right. Come back slowly. Turn to the left. Come back slowly. The other side. Come back slowly. The other side. Come back slowly and stop. Now we'll synchronize it with breathing. And once again, while we turn to the side, the neck is getting squeezed. So that is the time when we breathe out. Inhale. Breathe out as you turn the head to one side. Inhale as you come back to the midline. Exhale as you turn to the other side. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Now we'll synchronize it with chanting. And once again, while chanting, feel the soothing resonance of the chant and visualize the Mother or the Divine caressing your neck. Inhale. Exhale as you turn and chant. Ma. Exhale as you turn and chant. Inhale as you come back. Exhale and turn and chant. Inhale, turn. Inhale, turn. Inhale, turn to one side. Inhale, breathe out. Inhale, exhale. Inhale, exhale. Inhale. Okay? So again, like the previous movements, finally when the student has understood these and got a hang of it, one can do it 10 times. The person with acute neck pain, also once the person has got the basics and got practiced in doing it, the person can do it 10 times with synchronized with breathing and chanting, and do it 3 or 4 times a day. Now another movement which can also be done 2 to 3 days after the acute neck pain is hand stretch breathing. But then these are progressively a little more difficult, and therefore if the person finds that it's difficult, then the person can postpone that difficult movement by a day. So none of these is sacrosanct. How many repetitions, how many times a day, and when to introduce a little more difficult practice, all that, for that the most important thing is to listen to your own body. The patient should listen to the body. If the person finds that more repetitions or introducing a difficult practice makes the person step out of the comfort zone, then the person can step back a little, not stop repeating the practice, or not go to the more difficult one on that day, postpone it by a day. So the next practice that we'll do, which is a little more difficult, is hand stretch breathing. So again, similar to the way we do it in the standing posture during the warm-up, bring your hands to the chest, interlock the fingers, rest your hands on the chest and bring the elbows down. Now inhale as you stretch the arms. Bring them back. Again, straighten the arm. Come back. Now we'll synchronize with breathing. Inhale. Exhale. Inhale. Exhale. And you see the principle remains the same. We breathe out when we fold the body. We breathe in when we stretch or expand. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Now we'll synchronize with chanting. Once again, the chanting will be during breathing out. Inhale. Ma. Inhale. Ma. Inhale. Ma. Inhale. Ma. Inhale. Ma. Okay? You can relax in Shavasana. Feet a little apart, hands a little away from the body, palms facing upwards, eyes closed, slow and deep breathing. A person who has neck pain may also have shoulder pain. The two are quite often associated. And if that is so, then instead of placing the hands by the side with the palms facing upwards, one can place the hands on the abdomen. So you can place your hands on the abdomen. This will relieve the pain in the shoulders. And one can perform Shavasana in this position. So relax your body and mind. As you breathe in, the abdomen moves out. As you breathe out, the abdomen moves in. Slow and deep breathing. As you breathe in, the abdomen moves out. As you breathe out, the abdomen moves in. Continue at a slow, uniform pace. Now we'll introduce chanting while breathing out. Inhale. Feel the soothing resonance of the chant. Inhale. Visualize the caressing of the neck by the Divine or the Mother. Inhale. 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 Okay, the person with acute neck pain does not need bed rest. It's enough to go about your daily work, but just avoiding the painful movements of the neck. In some cases, there may be a collar that is required around the neck, but by and large, at least bed rest is not necessary. So at the end of these practices, the person can get up and go around one's daily task. Getting up can be made easy and simple by turning to one side and then getting up with the support of both the hands. So turn to one side, taking the support of both the hands, sit up slowly. Keep the eyes closed. We'll end the session with a prayer for universal well-being. Om Sarve Bhavantu Sukhinah Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukkha Bhag Bhavet. Om Shanti Shanti Shanti. Rub your palms. Cup the palms and place them in front of the closed eyes. Don't touch the eyes, just place the hands in front of the eyes. The eyes remain closed. Enjoy the eyes relaxing in warmth and total darkness. Bring the hands down slowly along the body. Come to a meditative posture. Open your eyes with a few blinks. Thank you.
Any questions or comments? Seems there are no questions. So maybe I'll add something which occurred to me after this video had been recorded. What I may call quick come, quick go back pain. I'm sure many of you have experienced that sometimes you get some pain in the back, which can be called acute in the sense that it develops quickly uh, while doing some work. Suppose you have been standing at the sink washing the utensils for half an hour. By the end of it, you have some back pain. The normal tendency would be to feel that, yes, it has happened because of this work. So let me lie down for some time and it will be all right. But there's something better than lying down that one can do. Of course, lying down in Shavasana will help. But there's something better than one can do. One can provide a counterpose. Why it happens while doing any such work in which we bend forwards is because of bending forward continuously for prolonged standing, or sitting with the back bent forwards. So you provide a counterpose, bend backwards, do it methodically, and you find that within a few minutes that back pain goes. The earlier one takes care of such a thing, the less likely that it will become chronic. So one of the first things to remember is that if your task is too long, then instead of trying to wait that, well, let me finish the whole thing and then I can take some rest, you can even interrupt the task for a few minutes in between. If the task itself was short, then at the end of the task, you can do those practices. And all you have to do is to say, if you are standing and it's best done in the standing posture, in the standing posture, just put your hands on the hips, inhale while bending backwards, and exhale while coming forwards. And you can couple this exhalation while coming forwards with chanting. So if you do that, you'll find that just with 5 repetitions of this type, you'll find that all that back pain, which developed over a period of half an hour, is gone with just 5 repetitions of that.
There's one question in the chat box. Are these breathing exercises and stretches effective in case of slip disc also?
Well, in slip disc, if the pain is acute, and sometimes it does happen, during acute pain, yes, they would be helpful. But then it has to be followed up with, it might have to be followed up with other practices, and also depends upon the severity of the slip disc. So it's better to sort of consult a professional, because in some cases, during the acute phase, this may not be enough. One may need traction or something. So it all depends on the severity of the slip disc.